NCLEX exam questions. Question 1. Which individual is at the greatest risk for developing hypertension? 45-year-old African American attorney, 60-year-old Asian American shop owner, 40-year-old Caucasian nurse, 55-year-old Hispanic teacher. African Americans have the highest prevalence of hypertension globally and often develop it at an earlier age. High-stress professions, attorney, further increase risk. Question 2. A 15-year-old female who ingested 15 tablets of maximum-strength acetaminophen 45 minutes ago is rushed to the emergency department. Which of these orders should the nurse do first? Gastric lavage. Administer acetylcysteine, Mucomyst, orally. Start in 4-dextrose 5% with 0.33% normal saline to keep the vein open. Have the patient drink activated charcoal mixed with water. Activated charcoal is most effective when administered within 1 hour of ingestion to prevent the absorption of acetaminophen. Question 3. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Angina at rest, thrombus formation, dizziness, falling blood pressure. Thrombus formation is a significant risk following arterial puncture and catheter insertion. Question 4. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degrees Fahrenheit. The priority nursing goal for this client is maintain fluid and electrolyte balance, control nausea, manage pain, prevent urinary tract infection. Pain associated with renal calculi is severe and is the immediate priority for nursing care. Pain is a psychological/physiological priority after ABCs. Question 5. What would the nurse expect to see while assessing the growth of children during their school-age years? Decreasing amounts of body fat and muscle mass. Little change in body appearance from year to year. Progressive height increase of 4 inches each year. Yearly weight gain of about 5.5 pounds per year. School-age children typically gain about 4.4 to 6.6 pounds, 2 to 3 kilograms, per year. Question 6. At a community health fair, the blood pressure of a 62-year-old client is 160/96 mmHg. The client states, "My blood pressure is usually much lower." The nurse should tell the client to go get a blood pressure check within the next 15 minutes. Check blood pressure again in 2 months. See the healthcare provider immediately. Visit the healthcare provider within 1 week for a BP check. A single elevated reading requires follow-up within 1 week to confirm hypertension. Question 7. A 25-year-old male client has been newly diagnosed with hypothyroidism and will take levothyroxine, Synthroid, 50 mg/day by mouth. As part of the teaching plan, the nurse emphasizes that this medication should be taken in the morning, may decrease the client's energy level, must be stored in a dark container, will decrease the client's heart rate. Levothyroxine should be taken in the morning on an empty stomach to prevent insomnia and maintain consistent absorption. Question 8. A 3-year-old child was brought to the pediatric clinic after the sudden onset of findings that include irritability, thick muffled voice, croaking on inspiration, hot to touch, sad, leaning forward, tongue protruding, drooling, and suprasternal retractions. What should the nurse do first? Prepare the child for X-ray of upper airways. Examine the child's throat. Collect a sputum specimen. Notify the healthcare provider of the child's status. These are signs of epiglottitis. The nurse must notify the provider immediately and avoid examining the throat to prevent total airway obstruction. Question 9. In children suspected to have a diagnosis of diabetes, which one of the following complaints would be most likely to prompt parents to take their school-age child for evaluation? Polyphagia, dehydration, bedwetting, weight loss. Secondary enuresis, bedwetting, in a previously toilet-trained child is a common initial sign of type 1 diabetes. Question 10. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Trichomoniasis, chlamydia, staphylococcus, Streptococcus. Chlamydia is the most common organism associated with PID. Question 11. To ensure proper client education, the nurse should teach the client taking SL-nitroglycerin to expect which of the following responses with administration: stinging burning when placed under the tongue, temporary blurring of vision, generalized urticaria with prolonged use, urinary frequency. A stinging or burning sensation indicates that the sublingual nitroglycerin is fresh and active. Question 12. Which classification of drugs is contraindicated for the client with hypertrophic cardiomyopathy? Positive inotropes, vasodilators, diuretics, antidysrhythmics. Positive inotropes like digoxin increase the force of contraction, which can worsen the outflow tract obstruction in HCM. Question 13. The physician orders fluoxetine, Prozac, for a depressed client. Which of the following should the nurse remember about fluoxetine? Because fluoxetine is a tricyclic antidepressant, it may precipitate a hypertensive crisis. The therapeutic effect of the drug occurs 2 to 4 weeks after treatment is begun. Foods such as aged cheese, yogurt, soy sauce, and bananas should not be eaten with this drug. Fluoxetine may be administered safely in combination with monoamine oxidase (MAO) inhibitors. Fluoxetine is an SSRI and typically takes 2 to 4 weeks to reach therapeutic effectiveness. Question 14. When teaching a sex education class, the nurse identifies the most common STDs in the United States as chlamydia, herpes genitalis, syphilis, gonorrhea. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the U.S. Question 15. A psychotic client who believes that he is God and rules all the universe is experiencing which type of delusion? Somatic, grandiose, persecutory, nihilistic. Grandiose delusions involve a false belief of having great power, wealth, or importance. Question 16. A child is admitted to the emergency room with her mother. Her mother states that she has been exposed to chickenpox. During the assessment, the nurse would note a characteristic rash that is covered with vesicular scabs, all in the macular stage. That first appears on the neck and spreads downward. That appears especially on the cheeks, which gives a slap cheek appearance. That appears profusely on the trunk and sparsely on the extremities. The varicella, chickenpox, rash is centripetal, meaning it is most concentrated on the trunk and less so on the limbs. Question 17. The following medications were noted on review of the client's home medication profile. Which of the medications would most likely potentiate or elevate serum digoxin levels? KCl, thyroid agents, quinidine, theophylline. Quinidine can double the concentration of serum digoxin by decreasing its clearance. Question 18. A client with AC34 fracture has just arrived in the emergency room. The primary nursing intervention is stabilization of the cervical spine, airway assessment and stabilization, confirmation of spinal cord injury, normalization of intravascular volume. Injuries at C3-C4 affect the phrenic nerve. Maintaining the airway and breathing is the highest priority. Question 19. A diagnosis of hepatitis C is confirmed by a male client's physician. The nurse should be knowledgeable of the differences between hepatitis A, B, and C. Which of the following are characteristics of hepatitis C? The potential for chronic liver disease is minimal. The onset of symptoms is abrupt. The incubation period is 2 to 26 weeks. There is an effective vaccine for hepatitis B but not for hepatitis C. Hepatitis C has an incubation period between 2 and 26 weeks. Question 20. The therapeutic blood level range for lithium is 0.25 to 1.0 milliequivalent/L, is 0.5 to 1.5 milliequivalent/L, 1.0 to 2.0 milliequivalent/L, 2.0 to 2.5 milliequivalent/L. The narrow therapeutic window for lithium is 0.5 to 1.5 milliequivalent/L. Question 21. A 27-year-old man was diagnosed with type 1 diabetes 3 months ago. 2 weeks ago he complained of pain, redness and tenderness in his right lower leg. He is admitted to the hospital with a slight elevation of temperature and vague complaints of not feeling well. At 4:30 p.m. on the day of his admission his blood glucose level is 50 milligrams. Dinner will be served at 5 p.m. The best nursing action would be to give him 3 tablespoons of sugar dissolved in 4 ounces of grape juice to drink. Ask him to dissolve 3 pieces of hard candy in his mouth. Have him drink 4 ounces of orange juice. Monitor him closely until dinner arrives. A blood glucose of 50 mg/dl is hypoglycemia. 4 ounces of orange juice is a standard fast-acting carbohydrate treatment. Question 22. During burn therapy, morphine is primarily administered for pain management because this route delays absorption to provide continuous pain relief, facilitates absorption because absorption from muscles is not dependable, allows for discontinuance of the medication if respiratory depression develops, avoids causing additional pain from IM injections. In burn patients, peripheral tissue perfusion is poor, making IM or SC absorption unpredictable. 4 is preferred. Question 23. Which of the following medications requires close observation for bronchospasm in the client with chronic obstructive pulmonary disease or asthma? Verapamil, isopten, Amrinone, Inacur, epinephrine, adrenaline, propranolol, Inderal. Propranolol is a non-selective beta blocker that can cause bronchoconstriction in patients with lung disease. Question 24. The medication that best penetrates eschar is mefenide acetate, sulfamylin, silver sulfadiazine, silvadine, neomycin sulfate, neosporin, povidone-iodine, betadine. Mefenide acetate is unique for its ability to diffuse through thick burn eschar. Question 25. The nurse would need to monitor the serum glucose levels of a client receiving which of the following medications owing to its effects on glycogenolysis and insulin release? Norepinephrine, Levoft, dobutamine, Dibtrex, propranolol, Inderal, epinephrine, adrenaline. Epinephrine increases blood glucose levels by promoting glycogenolysis and inhibiting insulin secretion. Question 26. Which of the following would differentiate acute from chronic respiratory acidosis in the assessment of the trauma client? Increased PaCO2, decreased PaO2, increased HCO3, decreased base excess. In chronic respiratory acidosis, the kidneys compensate over time by retaining bicarbonate, HCO3. Question 27. The initial treatment for a client with a liquid chemical burn injury is to irrigate the area with neutralizing solutions, flush the exposed area with large amounts of water, inject calcium chloride into the burned area, apply lanolin ointment to the area. Immediate irrigation with water is the gold standard for chemical exposure to dilute the chemical. Question 28. A male client receives 10 U of regular human insulin SC at 9 a.m. The nurse would expect peak action from this injection to occur at 9:30 a.m., 10:30 a.m., 12 noon, 4 p.m. Regular insulin peaks approximately 2 to 3 hours after subcutaneous injection. Question 29. When a client is receiving vasoactive therapy for such as dopamine, entropin, and extravasation occurs, the nurse should be prepared to administer which of the following medications directly into the site? Phentolamine, Regitine, epinephrine, phenylephrine, neosynephrine, sodium bicarbonate. Phentolamine is an alpha blocker used to treat or prevent skin necrosis following extravasation of catecholamines. Question 30. Discharge teaching was effective if the parents of a child with atopic dermatitis could state the importance of maintaining a high humidified environment, furry soft stuffed animals for play, showering 3 to 4 times a day, wrapping hands in soft cotton gloves. Cotton gloves prevent the child from scratching at night, which reduces skin breakdown and infection. Question 31. Priapism may be a sign of altered neurological function, imminent death, urinary incontinence, Reproductive dysfunction. In a trauma context, priapism can be a sign of spinal cord injury or autonomic dysfunction. Question 32. When evaluating a client with symptoms of shock, it is important for the nurse to differentiate between neurogenic and hypovolemic shock. The symptoms of neurogenic shock differ from hypovolemic shock in that, in neurogenic shock the skin is warm and dry. In hypovolemic shock there is a bradycardia. In hypovolemic shock capillary refill is less than 2 seconds. In neurogenic shock there is delayed capillary refill. Neurogenic shock involves a loss of sympathetic tone leading to vasodilation and warm/dry skin. Hypovolemic shock presents with cold/clammy skin. Question 33. A 30-year-old male client is admitted to the psychiatric unit with a diagnosis of bipolar disorder. For the last 2 months his family describes him as being on the move, sleeping 34 hours nightly, spending lots of money and losing approximately 10 pounds. During the initial assessment with the client, the nurse would expect him to exhibit which of the following? Short, polite responses to interview questions. Introspection related to his present situation. Exaggerated self-importance. Feelings of helplessness and hopelessness. Grandiosity or exaggerated self-importance is a cardinal symptom of a manic episode. Question 34. The usual treatment for diabetes insipidus is with IM or SC injection of vasopressin tannate in oil. Nursing care related to the client receiving IM vasopressin tannate would include: weigh once a week and report to the physician any weight gain of 10 pounds. Limit fluid intake to 500 ml/day. Store the medication in a refrigerator and allow to stand at room temperature for 30 minutes prior to administration. Hold the vial under warm water for 10 to 15 minutes and shake vigorously before drawing medication into the syringe. The medication is in oil and must be warmed and shaken vigorously to ensure the active ingredient is suspended. Question 35. When assessing a child with diabetes insipidus, the nurse should be aware of the cardinal signs of anemia and vomiting, polyuria and polydipsia, irritability relieved by feeding formula, hypothermia and azotemia. Diabetes insipidus is characterized by excessive thirst, polydipsia, and excessive urination, polyuria. Question 36. A child sustains a supracondylar fracture of the femur. When assessing for vascular injury, the nurse should be alert for the signs of ischemia, which include bleeding, bruising, and hemorrhage, increase in serum levels of creatinine alkaline phosphatase and aspartate transaminase, pain, pallor, pulselessness, paresthesia, and paralysis, generalized swelling, pain, and diminished functional use with muscle rigidity and crepitus. These are the 5 Ps of compartment syndrome and neurovascular assessment. Question 37. Signs and symptoms of an allergy attack include which of the following? Wheezing on inspiration, increased respiratory rate, circumoral cyanosis, prolonged expiration. Airway narrowing in allergic reactions/asthma makes it harder to exhale, leading to prolonged expiration. Question 38. A client is 6 weeks pregnant. During her first prenatal visit, she asks how much alcohol is safe to drink during pregnancy. The nurse's response is up to 1 ounce daily, up to 2 ounces daily, up to 4 ounces weekly, no alcohol. There is no established safe amount of alcohol during pregnancy. Total abstinence is recommended. Question 39. Which of the following risk factors associated with breast cancer would a nurse consider most significant in a client's history? Menarche after age 13, nulliparity, maternal family history of breast cancer, early menopause. A history of breast cancer in first-degree relatives significantly increases the risk. Question 40. The nurse assists a client with advanced emphysema to the bathroom. The client becomes extremely short of breath while returning to bed. The nurse should increase his nasal O2 to 6L/min, place him in a lateral Sims position, encourage pursed lip breathing, have him breathe into a paper bag. Pursed lip breathing helps maintain airway pressure and prevents airway collapse in emphysema patients. Question 41. As the nurse assesses a male adolescent with chlamydia, the nurse determines that a sign of chlamydia is enlarged penis, secondary lymphadenitis, epididymitis, hepatomegaly. Epididymitis, pain and swelling in the testicles, is a common complication of chlamydia in males. Question 42. In a client with chest trauma, the nurse needs to evaluate mediastinal position. This can best be done by auscultating bilateral breath sounds, palpating for presence of crepitus, palpating for tracheal deviation, auscultating heart sounds. A shift in the trachea indicates a shift in the mediastinum, often caused by a tension pneumothorax. Question 43. A long-term goal for the nurse in planning care for a depressed suicidal client would be to provide him with a safe and structured environment, assist him to develop more effective coping mechanisms, have him sign a no-suicide contract, isolate him from stressful situations that may precipitate a depressive episode. Effective coping mechanisms address the root cause and provide long-term resilience. Question 44. A client with emphysema is placed on diuretics. In order to avoid potassium depletion as a side effect of the drug therapy, which of the following foods should be included in his diet? Celery, potatoes, tomatoes, liver. Potatoes are a high potassium food compared to the other options provided. Question 45. When administering phenytoin, Dilantin, to a child, the nurse should be aware that a toxic effect of phenytoin therapy is Stevens-Johnson syndrome, folate deficiency, leukopenic aplastic anemia, granulocytosis and nephroses. Stevens-Johnson syndrome is a life-threatening skin reaction that is a known adverse effect of phenytoin. Question 46. A client with a diagnosis of C4 injury has been stabilized and is ready for discharge. Because this client is at risk for autonomic dysreflexia, he and his family should be instructed to assess for and report dizziness and tachypnea, circumoral pallor and lightheadedness, headache and facial flushing, pallor and itching of the face and neck. Pounding, headache and facial flushing are classic signs of autonomic dysreflexia. Question 47. One of the most dramatic and serious complications associated with bacterial meningitis is Waterhouse-Friderichsen syndrome, which is peripheral circulatory collapse, syndrome of inappropriate antidiuretic hormone, cerebral edema resulting in hydrocephalus, auditory nerve damage resulting in permanent hearing loss. This syndrome involves severe bacterial infection and adrenal hemorrhage leading to shock and circulatory collapse. Question 48. When teaching a mother of a 4-month-old with diarrhea about the importance of preventing dehydration, the nurse would inform the mother about the importance of feeding her child fruit juices, diluted carbonated drinks, soy-based lactose-free formula, regular formulas mixed with electrolyte solutions. Diarrhea can cause temporary lactose intolerance. Soy-based or lactose-free formulas are easier on the gut. Question 49. A client with bipolar disorder taking lithium tells the nurse that he has ringing in his ears, blurred vision and diarrhea. The nurse notices a slight tremor in his left hand and a slurring pattern to his speech. Which of the following actions by the nurse is appropriate? Administer a stat dose of lithium as necessary. Recognize this as an expected response to lithium. Request an order for a stat blood lithium level. Give an oral dose of lithium antidote. Ringing in ears, tinnitus, and blurred vision are signs of lithium toxicity requiring immediate lab testing. Question 50. The physician recommends immediate hospital admission for a client with PIH. She says to the nurse, "It's not so easy for me to just go right to the hospital like that." After acknowledging her feelings, which of these approaches by the nurse would probably be best? Stress to the client that her husband would want her to do what is best for her health. Explore with the client her perceptions of why she is unable to go to the hospital. Repeat the physician's reasons for advising immediate hospitalization. Explain to the client that she is ultimately responsible for her own welfare and that of her baby. Therapeutic communication involves exploring the patient's barriers and concerns. Question 51. The nurse practitioner determines that a client is approximately 9 weeks gestation. During the visit, the practitioner informs the client about symptoms of physical changes that she will experience during her first trimester, such as nausea and vomiting, quickening, a 6 to 8 pounds weight gain, abdominal enlargement, morning sickness. Nausea and vomiting is a hallmark of the first trimester. Question 52. Diabetes during pregnancy requires tight metabolic control of glucose levels to prevent perinatal mortality. When evaluating the pregnant client, the nurse knows the recommended serum glucose range during pregnancy is 70 mg/dl and 120 mg/dl, 100 mg/dl and 200 mg/dl, 40 mg/dl and 130 mg/dl, 90 mg/dl and 200 mg/dl. Pregnancy requires a tighter glucose range, 70 to 120 mg/dl, for fetal safety. Question 53. After 3 weeks of treatment, a severely depressed client suddenly begins to feel better and starts interacting appropriately with other clients and staff. The nurse knows that this client has an increased risk for suicide, exacerbation of depressive symptoms, violence toward others, psychotic behavior. When depression lifts, patients gain the energy to carry out a suicide plan. Question 54. When the nurse is evaluating lab data for a client 18 to 24 hours after a major thermal burn, the expected physiological changes would include which of the following? Elevated serum sodium, elevated serum calcium, elevated serum protein, elevated and hematocrit. Fluid shifts lead to hemoconcentration, which raises the hematocrit level in the first 24 hours. Question 55. Dietary planning is an essential part of the diabetic client's regimen. The American Diabetes Association recommends which of the following caloric guidelines for daily meal planning? 50% complex carbohydrate, 20% to 25% protein, 20% to 25% fat. 45% complex carbohydrate, 25% to 30% protein, 30% to 35% fat. 70% complex carbohydrate, 20% to 30% protein, 10% to 20% fat. 60% complex carbohydrate, 12% to 15% protein, 20% to 25% fat. Standard ATA guidelines recommend roughly 60% carbohydrates, 12 to 15% protein, and 25% fat. Question 56. To appropriately monitor therapy and client progress, the nurse should be aware that increased myocardial work and O2 demand will occur with which of the following? Positive inotropic therapy, negative chronotropic therapy, increase in balance of myocardial O2 supply and demand, afterload reduction therapy. Positive inotropes increase the force of contraction, which uses more oxygen by the myocardium. Question 57. The nurse should know that according to current thinking, the most important prognostic factor for a client with breast cancer is tumor size, axillary node status, client's previous history of disease, client's level of estrogen progesterone receptor assays. Lymph node involvement is the most significant indicator of prognosis. Question 58. The day following his admission, the nurse sits down by a male client on the sofa in the dayroom. He was admitted for depression and thoughts of suicide. He looks at the nurse and says, "My life is so bad, no one can do anything to help me." The most helpful initial response by the nurse would be, "It concerns me that you feel so badly when you have so many positive things in your life. It will take a few weeks for you to feel better, so you need to be patient. You are telling me that you are feeling hopeless at this point. Let's play cards with some of the other clients to get your mind off your problems for now." This is a reflective statement that acknowledges the patient's feelings. Question 59. A 6-month-old infant has been admitted to the emergency room with febrile seizures. In the teaching of the parents, the nurse states that sustained temperature elevation over 103 F is generally related to febrile seizures. Febrile seizures do not usually recur. There is little risk of neurological deficit and mental retardation as sequelae to febrile seizures. Febrile seizures are associated with diseases of the central nervous system. Simple febrile seizures are typically benign and do not cause brain damage. Question 60. The nurse is aware that nutrition is an important aspect of care for a client with hepatitis. Which of the following diets would be most therapeutic? High protein and low carbohydrate, low calorie and low protein, high carbohydrate and high calorie, low carbohydrate and high calorie. High carbohydrate and high calorie diets are recommended to allow the liver to recover and regenerate cells.